Thank you. I am Philemon Edu Brempong, First Vice Regional Chairman for Ashanti Region, a proud grandson of Oteko Kwoswo, Otumfuo Setutu, the second. Also, the Middle Zone Coordinator and acting as a secretary for the Youth Committee. Thank you.
My name is Kubari Sebastian. I am the acting second vice chairman for the Upper West region. I represent the Northern Zone on the Youth Committee, acting as the deputy youth coordinator. Thank you.
Please, we'd like to observe a minute silence for our past chairman. So if you could all be upstanding. May the soul of Chairman Prince Opuni Frimpong rest in peace. Amen. Please, I'll hand over the microphone to Mr. Philemon for the report.
Thank you. Madam President and Chair, please permit me to stand on the existing protocols. JRNMA Youth. I can see a lot of youth among us. When I say JRNMA Youth, you respond, ready to be mentored, prepared to lead. JRNMA Youth. Let's take it again. JRNMA Youth, ready to be mentored, prepared to lead. I am making this presentation on behalf of the Youth Committee. This was the membership of the committee. Prince Opuni Frimpong late, Secretary Ms. Lorena Bleba Ake, Southern Zone Coordinator, Ms. Loretta Korte, Deputy National Coordinator, Sebastian P. Bayiri, Northern Zone Coordinator, and myself. It seems the media committee what I'm saying, it seems they projected a different one, but no problem, we'll do it. These are terms of reference. Improve the youth-related work by strengthening the relationship between the JRNMA and the Nursing and Midwifery Students Union. And we are talking about GEMTA, the unemployed, and the rotational nurses unions, including ONSAC, which is the University Nursing Student Association of Ghana. Also, improvement in information sharing, retrieval, and feedback system. And we also tasked with the responsibility of serving and representing the youth of the association. Our objectives: to submit a program of work and action plan for consideration by the National Council to strengthen the relationship between JRNMA and the Nurse and Midwifery Students Unions, such as GEMTA already said, to improve in information sharing, retrieval, and feedback system, to commemorate International Youth Day through the National Youth Boot Camp, to visit a neighboring country to foster collaboration between the youthful nurses in the sub-region. And you can see the first objective have been done. The other 3 are in progress. 5 are in progress. Our key activities: organization of the annual Youth Boot Camp. Every year, we organize the annual Youth Boot Camp after the launch of the International Youth Day, which is on the 12th of August. So on that day, we do our celebration and launch the Youth Boot Camp, and it continues for 3 days. Resolution of GEMTA legal issues and successful elections. support and supervision of rotational nurses and midwives, and also leadership transition, engagement on unemployment crisis among nurses, interventions for unpaid 2020 batch nurses and midwives. And some have been done and others are ongoing with the support for the student unions, for the engagement on unemployment issues in the country. We have been doing those things. Achievements. Effective organization of the annual National Youth Boot Camp. As I have already said, we do this to empower the youth in the association through mentorship and also skills acquisition. And with the skill acquisition, we introduced it when we came, and in the past 2 years, we have trained not less than 400 youth in the association. At the national level, we trained about 200 last year, 100 based on the participation, and this year. And when you go to other regions, and in fact, if we are considering what Upper West has done last year, they are the only region to organize youth boots for their region, over 500 participants last year. This year, a similar one. They deserve a clap. Also, in Northern region, they have even extended the training of students, rotational nurses, and they are training them in their skills that they acquired. And they are also doing well, empowering the youth so that as they are in the house, they don't sit idle waiting for postings. They are doing something, and the training is ongoing. Other regions are also doing it. And we interact with them, and they tell us the testimonies. One lady said, oh, I used to buy yogurt for my kids every day. Now I'm doing it in the house, and I'm saving a lot of money. And this is what the youth boot is achieving. Won't you clap? Thank you, thank you. Successful resolution of the GEMTA leadership and legal challenges. GEMTA, they had leadership issue where they couldn't conduct their election for 2 years. So it came to our attention, and we informed President, and he delegated first vice president to lead. And successfully, we have resolved the court issue, and they have been able to conduct their election, and now GEMTA, they are functioning very, very well. Strengthening collaboration with affiliate groups. What we have done so that we can help with information retrieval and also dissemination, the coordinators, the zonal coordinators, we were assigned to each union. So GEMTA, we had Sebastian, rotational nurses, we had Lorena, myself for the unemployed. And with this, we are able to get information quickly from them and also intervene if there is anything that we have to do. And let me say that with this, Abraham Achiri of Eastern Region has been very, very instrumental. He used to be the leader. He used to be the leader of the unemployed, and when he started working, he has also been linking up with them, and it's very, very helpful. Like this year, with the disparities in the payment of salaries, he was the first person to bring it to our attention and tell us what was happening, and we had to relay the information to the national executives for interventions. Advocacy for youth employment and welfare, and we have been going to the ministries led by Reverend Philemon Japan. Strengthen youth visibility and representation at national forums, and we are happy to say that at this conference, we have ONSAC president as being part of the National Planning Committee, and we had GEMTA executives also being part of the LOC. And most of the things that the ashes we have been seeing, all those who are helping the rapporteur, we have the youth also assisting that. So we are trying our best to also increase our visibility in most of the things that we do. Challenges. Financial limitation. We are not saying national president and her team are doing very well to support us. But whenever there is feedback from PPME who assist us with the feedback. They said we should increase the number of participants. And National is doing well. Let's clap for them. Time limitation, which affects the depth of some training. For example, this year we're doing Fascinator. I was part of the Fascinators group, and we couldn't do all the training that we were supposed to do. Others with the soap making, they were able to go through. And all these things because we have the youth booth within 3 days, and we wish it could have been more days so that we can have 2 days skill training. High youth unemployment and salary delay. With this, because there are a lot of backlog and also salary delays, we are always having agitations among the youth who are unemployed and those in the house. And we try to save the situation. At times, it's become difficult. For instance, Reverend Philemon led us to the ministry. We had a meeting. They told us the situation with the unpaid salaries. As we were talking, we were on the platforms, and they were also planning demonstration. So we made them understand that, we cannot stop them. We will relay the information to them. And these are some of the challenges that we face. If everyone have been posted and salaries are being paid, it will lessen our burden. We pray for that moment to happen in Ghana. Limited cooperation from affiliate group leaders. You cannot completely control students and also the unemployed. In fact, at times you'll be calling, we'll be demanding for data, it's not coming. Not only that, when the salary issues came up, National through PPME, they developed a template to take data. We are on the platforms, they share the link, and instead of filling the data so that we can present accurate data to controller, some people will be saying what they want to say. And this is some of the challenges that we are facing. Way forward, strengthen funding and financial sustainability. We hope that we can have a fundraising team which can help mobilize some funds so that it will supplement what National has been doing, what Madam President has been doing, so that we can extend the days. Those who have participated in the youth booth, accommodation is at Shiashi and Zoti, we use those facilities. And when you take it outside, the cost on accommodation is even higher. So we hope that we can get a fundraising team which can do that. Enhance youth empowerment through training and capacity building. As we have already said, it's a high demand that we increase the participants for the youth booth. And with this, we are training them, capacity building, mentorship, and the rest. So we hope we can do that. Foster partnership and representation at national and international platforms. As already said, we have GEMTA and other affiliate groups participating in this. Improving internal capacity and leadership effectiveness and strong regional structures. Here, we hope that as other regions are doing, this could be replicated in all the regions. Also, we deal with the 10 regional coordinators. If they could also have other coordinators within the region to strengthen what they are doing. In every region, we have one coordinator who is looking at the GEMTA group there, the rotational nurses there, the unemployed there, and it becomes difficult if you have more than 2 schools and no region is having 1 school. And the agitation and the rest, it becomes something that is difficult to handle. Also, we are also hoping that there could be a digital system where every youth, we know the challenges that youth are facing, not only the unemployed, those employed. In terms of labor issues, some people go on maternity leave, they have other critical issues, some are facing sickness, abuse at the workplace, and all those things. We are hoping that we can use a digital platform to take data which we can work with, and we want PPMB and others to also help us execute that. Acknowledgement, we cannot do anything without Madam President. She is Yaputi Ya Gaddafi. In fact, there is only, the law people will say everything is a person. There is only one person, which is Great Olympics, which is having more titles than Madam President. But you see, it's only Great Olympics. But when it comes to president, she has all the titles. Madam President, we are very, very grateful. The National Executive Committee, we are grateful for your support and everything. National Council, the national and regional coordinators, you are doing awesome. The PPME, from the beginning to the end, they are with us. We are very, very grateful to the PPME for their support. The JRNMA Media, let's clap for them, let's clap for them. Recently, I was telling Reverend Philemon that, Reverend, I attended this program, international program, and I saw those holding the gables, crossing each other. They will appear in the cameras, but you don't see this as GRNMA programs. You don't see that. They are doing awesome. They are really doing awesome. Monimutu. And the youth of GRNMA, we salute. The gallery, as the youth committee, we started, we were 5, and now we have late opening. The youth committee were there to pay our tribute last year, and this year when we were having the youth boot camp, we had a moment, time with the stars. We read some tributes, and we had the regional coordinators also reading their tributes. As I mentioned earlier, there was a dispute, legal issue with Jemta leadership, and with Esquire Aklugu's intervention through Madam, we were able to resolve it. They had a successful election, and they also paid a courtesy call to President at the office. Rotational nurses and midwives, also after we have had a successful elections. This one was just in August at Ashanti region. National PRO represented President, and there was a citation that they presented to President for her support. The association is really doing well with the support of the affiliate groups. So this, afterwards, they came to Accra to introduce themselves to Madam President. Unpaid salaries, rotational nurses, and unemployed. The unpaid nurses, they are having issues. From April, when salaries started coming in, some were not paid. So they had issue with unpayment. Rotational nurses are also having issues with unpayment, and the unemployed. And with this, always we go to controller, and we go to the ministry, and this is mostly led by Reverend Philemon. So this is some of the visitations. Also, unemployed nurses, there was a need for us to review their constitution and also change leadership. And this was led by Esquire Aklogu. The youth boot, Ya Gaddafi. So this was last year youth boot, and these were the dignitaries present, the youth committee, National Youth Committee with the dignitaries present, and these were the participants. You can see the joy. And afterwards, we have time with NEC where the participants interact with the NEC, asking questions and also getting explanation to some of the issues they raised. Afterwards, we have, last year, we have the Code of Conduct presentation. Chama Opuni talked about the role of the youth, and we had Esquire Jones Efrian to Ashanti Regional Chairman also presenting on medical legal issue. This year, it was chaired by Esquire Aklogu, and these were the dignitaries present, and the regional and the national coordinators. These were the participants for this year. Time with NEC. These were NEC members present. So, General Secretary of the Association, Dr. David Kranchum was there Prince Dachehine, and we had Esquire also present. Then we had Mr. Supa, Assistant Treasurer and PRO. Then Anatomy of GRNMA, Anatomy and Physiology of GRNMA by Esquire Aklugu. Then the skill training, there is the fascinators group. We have the bees group. You can see the men touching the bees. I think they wanted to make it for their wives. Then the liquid soap. Then we had a tour of the Accra City. Then the baking. Then the coordinators with the chairman of the media committee. So there's the youth committee. Thank you very much. Thank you, Madam President.
Thank you so much, Youth Committee. Let's do it one more time for them. You can take your group picture. The next committee will be the Women and Gender Committee. Women and Gender Committee. I don't know. Of our cabinet. So, good afternoon. We are the members of the Women and Gender Committee. So when we say Women and Gender, you say unite and take up more space. Women and Gender. In fact, we have taken more space in this room. And so we hope and pray that our next election, the women will take up the leadership position in the district and the regional and the national. Yes. IT. So, our presentation will follow this outline and the membership. My name is Anna Kolinate. I'm the national coordinator. I will kindly ask my colleagues to also introduce themselves.
I'm Tracy Seduji Peglo, Southern Zone Coordinator.
I'm Diana Hans Wilson, Middle Zone Coordinator and the Secretary to the committee.
We have a five-member committee. Two are not currently here. They are Ms. Margaret Ofori, who is the Deputy Coordinator, and Sister Joyce Yegeia, who is the Northern Zone Coordinator. So our terms of reference is to develop and implement Women and Gender Action Plan to create opportunities and improve the status of women in GRNMA, to oversee all women and gender-related work and activities in the association, serve as an advisory body to the Association on Women and Gender Issues by representing women at all levels and helping to raise awareness of gender issues that affect both sexes at the workplace. Provide information to the union based on data from the monitoring the implementation of policies and strategies of the association in meeting the needs of women in GRNMA. To recommend programs designed to deliver changes in the thinking and behavior of women and prepare them to effectively lead in their profession. Become the driving force for national, regional, and district programs targeted at gender equity and equality within the healthcare environment. Assist the union to develop partnership with other women's groups and organizations to influence and ratification of the ILO conventions that border on women and work making recommendations also on new policies and programs of action, present quarterly and annual reports to the National Executive Committee and National Council. Our objectives: one is to decentralize women and gender activities in the regions to include all districts and facilities by the end of the year 2024. And we all attest to the fact that we are able to achieve 60% because we're not able to decentralize it into the district levels, which we hope and pray that from next year we'll be able to do. To commemorate the International Women's Day annually, we're able to do it last year, this year, and next year we will also do it. So it is still in progress. To empower women to take up leadership roles at all levels in the nursing and midwifery fraternity and workplace. And so, in view of that, we're able to organize a webinar on women in politics. And so we pray and hope that by the next election, our women will vie for positions. And we pray and hope that the men, you will give us the space. You don't give us the space, so you push us. To empower members of the association to chart their career pathways and develop themselves professionally. Mr. Dasa Zanu led this during one of our webinars. To collaborate with other women's agencies and organizations to influence the ratification of ILO conventions that border on women and work, including enforcing workplace policies that favor members of the association. And on this, we are in constant talks with the Health Service Workers Union Women's Wing, because they are also in the same group with us, to be able to develop something that will help our women. To embark on quarterly supportive supervision and monitoring of the challenges and progress of women in their fraternity. With this, we have not been able to do, and we hope and pray that we'll be able to embark on it. So our key activities and timelines. We've been able to select and train representatives in the regions, districts, and the facilities. We've been able to commemorate the International Women's Day, organize quarterly webinars to empower members to develop themselves professionally and economically. And surprisingly, the men also participated. We are grateful. Identification of women's organizations or groups. So we have identified through Madam President's engagement, we've been able to identify the Young African Women Conference, and we went for a workshop or a convocation, and they have also taught us something. And so we will also come and help our members, our women. Quarterly tour by the zonal representatives and coordinators to the region, districts, and the facilities. We are here to begin. Madam President, for this one, we need funds. Because we need regional representatives, that the regional coordinators and the district coordinators to tour their respective regions and the districts, so that we will know the challenges that women face when they want to take up leadership positions. We don't want to act on hearsays. We want evidence-based. Even our achievements, we've been able to organize a webinar on women in politics and stress management, live experiences of breast cancer survivors and economic empowerment among nurses and midwives. Then our men were not left out. There was a webinar on prostate cancer and pathways in nursing and midwifery. Then we're also able to hold all our quarterly meetings and in full house. We also had a webinar on integrating gender equity and women rights into health programs in Africa. Then we have celebrated the regional IWD in all the 10 administrative regions of the country. And we also participated in the York Convocation 2025. Our major challenge has always been finances, because we want our women to move to the district to empower our other women. And so finances has always been a challenge to us. Our way forward. is to build capacities of women for their voices to be heard and their effort to be recognized through seminars and webinars, conduct regional tours to all the 10 administrative regions of the association, celebrate the International Women's Day with a 5-day camp, which will include seminars and capacity buildings for members. So we don't want to do the usual 1-day lunch, then we move to the regions, but we want to have a 5-day 5-day camp with all the women, at least 10 from each region, so that we'll be able to impact knowledge and they will go and also do same to their constituents. To collaborate with other women agencies and organizations to influence the ratification of the ILO conventions that border on the women and work, including enforcing workplace policies that favor members of the association, and engage the Ministry of Gender, Children and Social Protection, regional CNMOs, and deputy directors, human resource at the regional levels. Mostly, this harassment, sexual harassment, abuse and everything, it happens at the regional and district levels. And our CNMOs are there, our HRs are there. And they know the people that have been affected because mostly they report to them. So we want to contact them so that they will be able to give us the data on that. And based on that, we act on it. Research and development of assessment form to evaluate workplace policies that favor nurses and midwives. Then our recommendation, 1, to embark on supportive supervision to all the regions, because this will help us increase the interest of women in taking up leadership positions. Then mentorship programs and capacity building of members at the district level through seminars and workshops. This will also help promote mentorship and build mentor-mentee relationship to facilitate professional development and efficient running of programs that empower women. And acknowledgement, we would like to say a very big thank you to Madam President, NEC, National Council, all facilitators and resource personnel who contributed to the success of our webinars, our GRNMA media, regional executives, district executives, and everybody. Thank you. So, yes, this was IWD at the regional, national level. Then we move on to the regions. So Eastern region is there, Ashanti, Brown and Halfo, Volta region. So we went to all the regions. Then finally, the Women and Gender Committee, the workshop we talk about, the Young African Women Conference convocation. Thank you.
Let's do it one more time for the Women and Gender Committee. Thank you, thank you, thank you so much. You take your photo and then you give the stage to the Media Committee, which is the last but not the least. Let's put our hands together for the GRNMA Media team.
Unity. Is that- We have the whole day. There's nobody there to project the stuff. So, all right, so you close the machine. All right, good afternoon to you all. So, so have you realized the essence of the media committee? As soon as we move here, everything becomes a standstill. I think you can clap for us for making the presentations possible. So if we don't even present, we have done our work. All that we wanted to say is to say thank you to Madam President for giving us this opportunity to serve the association. Since she came to office and she established the media committee, it has given an eye to the association. We have all our programs well archived. So as we speak, when you go online, you will see everything that we are doing from 2019 to date. When you go back, you realize that they did a lot in 2013 and 2009, but it's not saved. You can't reference it. And we want to use this opportunity to say thank you to her for the good work she has done. On that note, I think we don't have anybody to project for us, so we will end our presentation here, and then you clap for us. Thank you very much. You will do something. Okay. They said they will do something, so once they will do something, my name is Philemon Japon, the chairman for the media committee. Let me allow them to introduce themselves then. So, Blay.
Okay, my name is Kobe Blay, and the secretary to the GRNM Media Committee.
All right, thank you. My name is Seth Okai. Good afternoon. All right, so my name is Seth Okai, the Central Regional PRO, and also a member of the Media Committee.
Good afternoon. My name is Solomon Ajao, a member of the committee and Greater Accra Regional Secretary as well.
Good afternoon. My name is Willemo Jefferson Asari, Acting Regional Chairman and a Media Committee member. Thank you.
My name is Edith Abinate Chiwawuva, member of the committee and an acting chairperson of the Midwife Society.
Good afternoon. My name is Maoli Adednao, a technical support into the media.
Good afternoon, Madam President and the entire House. My name is, My name is Ideas Coleman Adato, a member of the Media Committee, a member of the delegation from the Greater Accra delegation team of GRNMA, and also the caucus chairperson. I'm still the caucus chairperson, yes, and also the regional assistant PRO. Thank you. Greater Accra.
My name is Robert James Osam Chei, a media technical officer and also the national loans officer. Thank you.
My name is Henry Clinton Quist, technical support to the media committee. Thank you.
All right, thank you very much, comrades. So at least we have one fine gentleman at the back who is helping us project, and we are proud that we have someone to help us. So in order to make our presentation brief, I'll call the secretary, Mr. Kelvin Odonko, popularly known as Kobe Blay, to do that, and I'll plead with the technical support team to be on the bench so that they can project. The reason why you couldn't see them when they were speaking is because there's nobody to zoom the camera and put it on them. When you were doing it, we were doing so that you can be seen. So allow us to make those modifications. Thank you very much. So the technical support team, you can go back. Blay, quickly. Thank you.
All right, so I'll quickly go over the introduction. So that's our chairman, and that's us, and the subsequent teams, and then that's our technical team. So it's important to stress the fact that our being is by virtue of these platforms that we use, that gives us visibility, which we were taxed by Madam President. And for those of you who are not connected to our platforms yet, we encourage you to do so before we get out of here. And so these are our TORs and our objectives. And key activities that we have done in the year under review includes live production, videography, photography, social media, and digital content production for all associations' activities. And notable amongst them include the 65th anniversary, the maiden conference of ANMC, the ICN Congress, which we did more social updates, and the famous nationwide strike. We also did the youth boot camp and dinner and awards night awards. So as part of our mandates and being innovative as we are, we started what we call the Nurses Cafe. And the idea was birthed whilst we were on our way to for a training in Cape Coast in our first year mandate. And we thought it was very necessary to highlight the concerns of nurses by doing these live productions and engaging with them. And we've held quite a number, about 8 of them for the year in review. We've also been doing the documentary filmings for national awards, and you know how much it could cost for the association to do documentary filmings nationwide. For some of us who are production people alongside our nursing, we know the cost involved, and to realize that the association is taking this initiative to mobilize its own members' resources to do the filming is noteworthy. We've also held trainings and capacity buildings, not just for ourselves, but also for some regional reps and PROs, including influencers. And each day, we never sleep because you have to do media monitoring. That is 24/7. So whilst we are running shifts on the wards, we are running shifts on the platforms to keep us safe and clean. Yep. Now, our achievements, and we are going to show you so many beautiful data, but for the purpose of time, quickly, in the last 2 years, we've been able to marshal over 10 million plus views for our social platforms. And we know people who are very much interested in doubting these figures. I mean, we are even being very noble in giving you the 10 million views. And we've increased in our reach, we've increased in our follows on our digital platforms of over 20,000 followers. And we had 150 unfollows. And you would understand, for those who came in to get content to please the agenda, we do what we call content moderation, where we block, and we are not shy to say it, we block you if you go against our editorial policy. And we've also increased our content interaction. It is one thing posting, it is another thing getting people to interact with the content. And even generating content that is interactive worthy. And that is what we do. And we have hit over 300,000 for that. We've increased our visit to our social platform, that's over 700,000, and increased our conversion. For conversion, it means that when people come to our socials, what else do they do apart from engaging with the content? And some include the visit to our website, some making up concerns, raising concerns. Adato takes care of that, and then chairman and the rest also handles the rest. So some of our other achievements include the training of the media committee. It's important to continue building our capacity. But one thing that was very interesting this year and the review was how we engage with our regional PROs, and we are grateful to the National Executive and our chairman for having ensured this was done, because we have so many stories, but it is about how we are able to communicate this. So we put together what we call the social media training and visual storytelling, and interestingly, we had what we call a field trip, where each region was given a task to film from where we were to the facility we went to visit. That's the Kwame Nkrumah, mausoleum, So they went and they did their filmings, photography, and some of the regions did well. Some also chewed, but that's fine. We still have the scores. We will announce it here. We also provided media production for partner health agencies and affiliates, and some included the ICN, PSI, the GCNM, Ghana Health Service, University of Ghana, and also supporting the day in a live filming for the BBC, which the team led by our talisman took us to the field together at that time. We ensured effective promotion of all effective promotion for association benefits and welfare, established and maintained the media plan and templates. So when you call the media team or the media committee for any activity related to media, we would have to share with you what we call the media template to be able to help us plan, so that we know the objective from start, we know what we are delivering, and then could be able to measure whatever we're able to do. And as well as providing technical and media support for all committees, like they've been acknowledging us. Some are not, but we are okay. We provided exclusive media coverage for the ICN CEO, that's Howard Cotton, to Ghana. And we have influenced our positive virtual sentiment for neutral. In our first mandate, we took up from a very negative, and it was read, and very negative sentiments when we were taxed by Madam President. Then we moved over to neutral. Now, after hitting neutral, we started having some challenges in moving to a positive. And then we had the strike, and it got really worse. But it would have been difficult to move, to hold on, and fall back to red. But we're able to now get back into a green, and we are good to go. Now, we realized how powerful TikTok was during our strike, and so we had to make sure that our accounts that we created, we had to revise its activity and also have some influencers engaged. We have enhanced our media monitoring, and we've also made sure that there is good collaboration, both local and international media. For example, when we have the breaking news, and Madam, permit me to share how we had to do this. When we had to break the news of calling of the strike, most of you realized Madam President reading the statements live. Actually, we had to set up from Ghana while she was in Finland, that's fine, Helsinki. So we had to set up from Ghana, and then Madam President and GS and the rest of the team, Chamanadi, were right behind it. And for me, I'm excited about the speed at which Madam President has gone with his media and tech savvy. it really proves a point that she's. All right. I think I've mentioned this. Most important for our year under review is how our chairman led us to initiate the crisis communication intervention. And we would want to encourage all regions to have this in place. I think it was for that reason that the NEC even supported us to train the regional PROs to ensure that we have some crisis communication plan always in place. When things like this escalate, what do we do? Because at a point, all the media stations were against us, and we had to quickly think through. We were not sleeping, meetings, and you know, PROs have to be at the media houses. So whilst they are there, what else do we do? Whilst they are speaking, how do we engage our members online? And some were demoralized, but I'm sure that when we activated our content, increased our content, heightened the engagement, it relieved a lot of us. We also, some of us use our individual platform in connection with the national platform to initiate some campaigns, and I'm sure some of you saw how effective that eventually was, especially those who thought we were dumb, right? Yeah, I'm not mentioning anybody's names, man. So these are some of the activities that we did, and that was, that's Howard Cotton, the CEO of ICN. This was the National Awards, dinner and awards night. And this, we have very serious photos of how things went in there, and you should have been there to see. But we are showing you some of these photos, how tensioned and heightened the emotions were in the House of Parliament when we have to be there. I think we were the only media that was allowed to be with Parliament and the GRNMA. And let nobody deceive you. We saw how they tried to use some Abuchi press release to let it look like they were there. Trust me, there was no other media. Even the traditional media that were invited were asked to wait for us to be able to put everything together. Right. And this was during our training. Adato can sometimes be very... So this is our Nessus Cafe production, and we use the hall, the big hall. For anybody who is quite technical would understand that this is not the best. So we would almost and always be having problem with the sound and arrangement because other events are there. We sometimes have to wait into the night. You have to move your equipment quickly. So we've had some recommendations in this to this effect, and we would share. This is the data from how our strike action was engaged during the period. So you realize that most of the content on the strike action was sitting on top, especially when we came out of the parliament, during the parliament meeting, and the issue of rage, and then our survey, which was put out there for us to decide which one we want. And of course, our GS became a talk for our people. Yes. And you know the viral audio. So this is some of the data we are extracting. Now, you realize that we share certain data, media content a lot. It's informed by what we gather behind the scenes. We realize that multiple photos, people love to see themselves on the association's platforms. So by the direction of our chairman, we continue to ensure that we are putting multiple photos out there. And photos still sit on top. The reels are also working, so we've also enhanced our work in that area. And for this 10 million, to be honest, this 10 million views that you're seeing there is actually for just about 14 months. So it's more. All right. And no other platform or association is having close to 1% of this data. We won't tell you how we know what they do at the back end, but we know. And it's ethical. So these are the top cities that are engaging with our content. Number 1, Greater Accra, where I come from and I work. Followed by Kumasi, and then Tamale, and Tema, and Takoradi, Cape Coast, and Ho, and Wa. It tells the story about how much we need to do. And when we completed our editing of the social platforms, what we also realized that there was so much gaps. Most regions are not even using pages at all. They are using groups and accounts that are more like a friend, an individual page, which cannot support the activity you do. You will not be able to even monitor what you do. But if we all are supposed to work together, this is the estimated audience we could be reaching with our social media work. And this is for average a day to 7 days. We could be hitting these numbers if we are all to work together from the regions. And you see the numbers that are the highest. The men are still leading, or are leading when it comes to the engagements. But I also thought we had more women in nursing. So the challenges and risk, we definitely need a studio for our work, or an office space to help us, not just with our work, but also to ensure that the equipment and all that are under the right temperature and keep. If not, we will spend our dues getting these equipments and they wear down very quickly because we go into the very rough terrains to do the coverage and the works. Today we are here. The temperature is different. The equipment and what you use, sometimes you need to keep it much more ventilated. When you go down, so different weather conditions even affect it. But when we get back to store it, we should be able to keep it safe. So our studio, where you can even come to be featured on our Nurses Cafe, is what we are all seeking for. And we seek for your support to ensure that this comes to fruition as early as Q1 of 2026, right? Okay. And the capacity to cover events. We realize that sometimes people are interested in having the national media be there for them and cover. We've had quite a number of inquiries, but the capacity is limited to what we can do for now. And hopefully, under the direction of our chairman and the national executive, we would be able to expand. Resources, tools. We always need tools, and we need a media van. Sometimes you go on the trip and you come back, and yes, we have equipment broken, and our spines too are as we Aboniki is not helping enough. We seek also, we've had consistent challenges also from our districts, because we believe that the district touch the base of our members. However, we realize the gap that is still existing, even from the regional level to the district level. We often don't have time allowance for prep-ups, so we are always on the go. In the last 1 month, we were on the field filming, and after that, we converged in Accra for another filming. Then we spent another week elsewhere, and now just the day after, we are here, and we are doing this. And when we finish doing this production, on Monday, Upper West, Upper East, and here. Then we have to go back and do all the editing for the videos you see, while still maintaining the social platforms and our contents. So, yes, and our personal nursing work has to continue. some of us. So we also have challenges with our sound management, and I'm sure some of you might have encountered this, especially during our streamings. We are hopeful that we'll be able to enhance it. We've had quite a number of cyber attacks. We've had people trying to hack our accounts. And sometimes around 2 a.m. we get a notification and all of us have to be up wherever we are and redeem the whole platform. We've had consistent. They will use different means, but we are here. We are vaccinated now. And I think there is consistent misinformation about us that persists on the platforms, that people come back, ask questions, some say other things, but these days we've enhanced our comment moderation, and sometimes Madam President will draw your attention. What is happening? And we make sure that we get back to work. So this is our vehicle on the road. There are times we use the streets. Sometimes you have to go through the forest, the bush, to go and get the filming done. And you don't have the luxury of rest, don't have the luxury of time. The night is coming, you need to hurry up. The nurse is waiting, the community have gathered, and they are waiting to be filmed, and you have to be there. One beautiful thing that happens whilst you're on the field is how out of our media production work, members of the media committee are tasked by our chairman to do what we call the agenda. We go and we switch members, those who have decided to move anywhere else, Adato as seen in the image, will do that and ensure that it convinces you within the next 5 minutes. By the time we are done filming, every nurse within the facility have switched. And there are times that when they see you, they feel bad about not being part of the association. And I think it's a good thing. We being in the facilities enhances also the visibility and engagement. So this is some of the communities we visit. And you have to travel that road, in between that, go through the forest. And when you call chairman that we are tired, he's like, make sure you finish the work. Now the way forward. Apologies, GS. GS is our godfather. He has made us to look this beautiful. We are very grateful. But we still have to look forward, just as you've taught us. So can I carry on, sir? So we hope that we would get a media studio and office and transition our Nessus Cafe into a sort of a Nessus TV by Q1 2026. We appreciate that PPAB has launched the campaign for our media van, and so we reiterate on the fact that we need the media van. We want to make sure that the social media policy is established clearly for the regions and districts, and we want to sustain the trainings. We want to delve into what we call the digital angels, and this will be, imagine if every district there is one person. How many districts do we have administrative? So 260. Let's just say there is one person in every district who comes to post on every post we made on social. 260 comments. Let's just say 100 people just comes to comment out of the 260. And they leave and they share, right? They share it, 100 people sharing our content. 100 people liking. At a go, 100 people commenting positively. You realize that anytime you post something and a negative comment comes, the rest follows. So why are our districts refusing to marshal their forces, as united as we are, to send that to our digital platform? So hopefully, we want to see our districts supporting us, even if it's 100 people per each content. And want to also enhance our influencers partnership. Our content segregation. You realize that we'll be streaming here, But there are so many of our members in the rural areas who don't have the data or the luxury to follow it live. And much as we have the data package being put out there, it's still a challenge. So we are making sure that whilst we post the photos, we are posting reels, we are posting short videos, we are posting flyers that they can also consume. So that whilst those who have the high bandwidth, those with the low bandwidth too can also have some fair share over the content. Now for our recommendations, I think they ran almost through. And yeah, this is one of our sessions for the Nurses Cafe. But we need to be honest. Like I said earlier, Mrs. Perpetua Ferampofo has done incredibly well for positioning the media of the GRNMA. And she is the executive director of the National Media Committee. Chairman, with your kind permission, let me share in 30 seconds or 1 minute when I first told Madam Perpetua about this media work. It was very long ago. And she was like, go ahead and do it. I think she was becoming General Secretary. And she said, well, it's not official, but whatever you guys are doing, go ahead and do it. And since then, I think it's 2011, 2010, that way. And she was positive about it. This is a woman with vision, direction, and the strongest of conviction for all of us. And so we are very grateful to you, but we know you have disciples who are equally supporting us, and we are grateful to them. And to every one of you here who continue to support us, people like OJ and all of you. I'm sorry I may not be able to mention names, but you all have been very supportive in pushing our content. And the team, there is never a harmony with a team. You see what's happening here? They will say something is missing, you didn't add this and all that, then we will struggle. But the output and the quality is everything we are looking out for. So we are grateful to everyone, and God bless you all.
All right, can we clap for our secretary for you can come back for the picture if Madam permits us. Thank you very much. Yes. Oh, we can't use it too. Praise, we are done. Thank you.
Thank you so much, Media Committee. Please, let's put our hands together for them. As nurses and midwives who are practicing, it is not easy. But they are so committed, and they go on all assignments with passion and the zeal to deliver. And therefore, we appreciate what you continue to do. We've seen the statistics, and we thank God for how far He has brought you as a committee and the entire association. Thank you so much. So that was the last committee to deliver their report. At this time, we will spend just 10 minutes to receive 2 abstracts. I know the first one will come from Kofi Adams. You have 5 minutes. And then the second one, I'm not too, Francis Wooney will also present. So I'm allocating 10 minutes for that, 5 minutes each. So can we have the 2 of you upstage so that you can do this abstract presentation for us to continue our business for today? And having said that, the specialized societies should please get ready. You will also have 10 minutes each to do your presentations. If you haven't submitted your slides already to the team, do it now, because after this presentation, we are zooming into the specialized societies. And we'll start with the Emergency Society, Emergency Nurses Society. Are you in the house? Emergency nurses. Thank you. So you'll be the first, and you'll be followed by the Perioperative Nurses Society. Or your name has changed. Ghana Gaspon. Thank you.
All right, so good afternoon to everyone, and then thank you so much, Madam President, the chairperson for today. All right, so we are here to present an abstract that we submitted on behalf of Greater Accra. So just a quick one, we did conduct a study in Greater Accra region. As a region, we did look at a few things that applies to us in them. Because I think over the course of the year, as a region, we have tried. So as a way of introduction, my name is Kofi Adams. I'm the Assistant Regional Secretary. And I'm here with my boss, the Regional Secretary. I think Mr. Coleman would join us. And Madam Kate. Oh, sorry, boss, I didn't see you. So we did conduct a study in the region. On behalf of the region, we had wanted to find out that as a region, Greater Accra, we wanted to look at our strategic location. Is it because we are positioned in Greater Accra? That is why we are known as Greater Accra. That's why we are prominent in the association. Or it is because of our strategic actions that we are doing. Because we believe as a region that we are doing a lot for the association. But then again, also, we can't just use our lips to say that we are doing a lot. We learned from yesterday that we need to look at evidence-based practice. So we decided to conduct a study from the scratch, to look at it, interview a couple of people. So our study will be looking at strategic location or strategic action, where we did explore the GRNMA Greater Accra influence in national GRNMA. So as a way of introduction, there are a lot of, a couple of professional associations and unions that play more roles or vital roles in here. So a couple of studies have actually said that, on and on. And then also I want to, place more emphasis on a study that was conducted by the association led by Madam Perpetual Forian and then the others, where they did look at the influence of the association with the history and then what have you. So our study objective, we wanted to study critically the influence of Greater Accra GRNMA on national GRNM, where we want to question ourselves to know whether our prominence is as a way of our geographical location, our proximity, that we are closer to the National Secretariat, or it is because of our strategic actions and then work we are doing. So to take you back a bit, or as a way of background, if you had followed Greater Accra Journey, you realize that this year we have decided to go on a tangent of, teaching and then research, where we have done a couple of, every quarter we do webinars. If you followed us, we've done 3 webinars, and then we have 1 webinar to come before the year would end. So we wanted to do the study to find out that, is it because we are closer to the National Secretary, that is why we are prominent, because that is what we are saying, that we are prominent, or it is because of our strategic action? So we put it into a research to find out that what is really happening. And our study did use what we call the purposive, sampling. We did have about 12, samples.
the questions.
research and how it is structured. And the essence of research, which is to identify a problem, go in study and find solutions or recommendations, I can't really see it featuring here. So, regions, upper west, central, Volta, eastern, northern, and all the rest, conduct regional researches. So thank you for sharing your thoughts with us. Thank you. Thank you. Thank you. So we'll now give the floor to Francis. Francis, you have 5 minutes.
Thank you, ma'am. Hello, can we be together? So, I am standing here, I am not the PI. The PI for this state is Madam President. And so, in fact, GS, you are supposed to be here too. So that Madam President is the PI. If she decides to open the floor for questions, you know where they should go. I rest my case. I rest my case. Yes, I rest my case. Thank you. So, at least you should understand why they presented before us because theirs is current, they cited us. That's beautiful. And we pray that they will get published, their paper get published, and we get citation. It will increase our recognition. In any case, yesterday we looked at the topic, harnessing the economic power of nursing and midwifery practice. There are two ways of looking at it. The positive contribution, the positive economic contribution of nurses and midwifery practice, and the consequences, the economic consequences when those contributions are withdrawn. Please, okay, good. So we are going to look at the economic consequences when the contributions are withdrawn. Madam President is the PI, and as you can see. So it's obvious that there are a number of reasons why nurses embark on strike actions. For money. Money. And the second one, when the government failed to, to honor the condition of service that we have agreed on. Just like what happened this year or last year. You know, it took us to strike action. Then there are other factors such as condition of poor working condition of service, demotivation among others, and unfairness in the system. One of the years, nurses and midwives got up and realized that government has given pharmacists and doctors some allowances, so they had to embark on a strike for about 6 weeks. And then strike actions generally, of course, have negative impact on access to health services, as you are aware. Apart from that, the impact can be negative consequences. And this was evidenced in Kenya when they conducted a study and they found out that it reduces admission up to 79%. And then similar findings were also reported in surgical department. And strike actions also affect the training of student nurses, medical students as well. So this was the thing. We realized that in 2020, when we embarked on the strike, we reflected and realized that we have a lot of history about strike action, but no group has examined the impact of our strike action. Being the largest health workforce, we have not examined the impact of our strike action. So we came up with three objectives, two. The first one was to determine the people accessing and utilizing health services before, during, and after the strike action, so that when we compare the trend, we'll get to know whether we have influenced services negatively or we don't even have influence at all. And then to compare the people accessing the essential services, as I said. So for our method, the setting was we conducted the study in 181 facilities, and then it was conducted in check and government facilities. We excluded private facilities. You know why? Because their conditions of service are different from us. And this was a retrospective study,
that we did. And so a total of 112 field officers were employed through the regional GRMA chairpersons across all the system regions. And we had a dedicated platform, WhatsApp platform, where we took them through how to gather the data gathering process. How to ensure data credibility, how to avoid contamination to ensure that they avoid contaminating of our data and ethical conduct of research. So we took them through all this. So there were 6 variables that we operationalized as healthcare delivery. Then we look at the number of people attending OPD services. We want to find out whether during the strike action it has reduced. Wanted to look at the admissions, whether there were reduction in admissions. Wanted surgeries. Wanted to know whether, deliveries as well, reproductive services and antenatal care services. So these were the terms we operationalized as service delivery. Then data collection, as I said, we collected the data. The strike was on 3 days. Monday, Tuesday, Wednesday. That was on 21st to 23rd. We collected data on all these 6 items. Then before the Monday, Tuesday, Wednesday, before the strike action, we also collected the same data. And then the Monday, Tuesday, Wednesday, after the strike action, we collected the same data because these days the activities are similar. And so ethical clearance, of course, we comply to all ethical principles as required. But the most important thing is that we collected aggregate data from the facilities, and so there was the Research and Grant Institute of Ghana, the Ethical Review Committee cleared that there was no need to go for ethical clearance, so we complied. And then the analysis, proceeded with 2 assumptions. The health facilities fallen under the same, under a particular categories will be similar in terms of the ranges of services. I also said the health facilities under the various categories, regions will be similar in respect to the average number of services they get. And then we computed the mean average of all the admissions, all the surgeries, and that is what we have as resource. Now, our resource, as I said, 181 facilities, hospitals were 51.4, health centers were 35.4, and chiefs compounds were 8.8%, and polyclinics were just 4.4. This is how we fed. If we say we are the largest workforce, the green down there is before the strike action. Then the blue in the middle is during the strike action. And the yellow up there is after the strike action. And so you could see that in regions like Ahafo, OPD attendance went drastically down. You go to Bono East and other regions, OPD attendance were completely out. And that was in 2020. And that tells you our impact. We negatively influence the strike actions. Where is Greater Accra? Good. They can see their level here. Then data on mean admissions. Data on mean admissions. So the strike actions also reduce admissions drastically across the entire country. Over 80% reductions, as you can see. And so our strike actions are not small things we should look at. Then we look at deliveries. Deliveries were greatly affected. If you look at northern region like this, deliveries were just, you wonder, where were they going? You see, some of these people were going to private facilities where the cost of services were high. Others too had to travel miles. Others have to deliver at home. And so they come with neonatal sepsis, the rest. That is the economic effect when the strike action is withdrawn. Then we look at surgeries. Surgeries were also worse affected, except Savannah region. Savannah. The reason was, in that region, we took the data from a CHAC facility, and I'm sure they did not adhere to the strike action. Then reproductive services, as you can see, reproductive services is one of the worst. In northern region, or is it, that's northeast region, it was 0, northern region 0, other regions 0. Reproductive services came down. And so that is it. You also look at antenatal care services, and you can see the zeros as well. Northern region, among other regions here, recorded 0. It means the strike action was really affecting. And listen. So this is this. Strike actions are not new. That's the last slide. Strike actions are not new. Our strike action was in 1974. And that was 14 years when we came into being as an association. And let's listen to this. In 1978, why did we go on strike? Government decided to give doctors an office at Kolebu, pharmacist's office at Kolebu, and give them Peugeot card. Our members were left behind. They had to go on strike. And they achieved that. The same year, government, our members realized that they were what? Chief nursing officers, deputy chief nursing officers, doctors are deputy, pharmacists have deputies, and we were the only group left. And we were ending at PNOs. So if they had not gone on strike, I know all of us, a lot of us would have been ending at PNOs. So sometimes strike actions, they are unnecessary evil. And you can't, they are necessary evil. You will sometimes need them. And then look at 1972, the longest strike action. When they got up and realized that, 1992, government decided to give pharmacists allowance, doctors allowance, and left us. Our people said, this one there, we have to press them. And they have to press them so hard, till chief imams, till teachers, till all pastors came, and they resolved the strike action. Look at this 2020 strike action. We also had fuel. If the strike action, if we have not embarked on the strike action, I'm sure the fuel that we have had an increment in the last negotiation wouldn't have happened. And so strike actions are necessary evil. As unions, we don't need them. We don't want to always embark on strike actions, but the gains too. If you don't do that, you always lag behind. To conclude with, the strike action affected service delivery negatively, and therefore understanding the economic impact of strike actions provide compelling evidence for investing in and supporting and strengthening the nursing and midwifery workforce as a strategic pillar for national development. Thank you. As I said, questions to Principal Investigator.
Why are you running away from the questions? Please, 5 questions for the team. Please line up. 5. Questions or comments? 5. Okay, we have 1. If Etonam had not risen, something would have happened. You ask your question and let's move on.
All right, Madam President, thank you very much for that recognition. All of you here, try and be like me so that Madam President will know you. All right, so I think if you can put the last slide, the conclusion on the screen, I'll be very grateful. Thank you. So, therefore, understanding the economic impact of strike actions, provide compelling evidence for investing in and supporting us. But I want to know from your discussions, I haven't seen how we've been able to link the lack of provision of those services to economic impact that it had on the nation. For which reason we are saying that it's having economic impact. Maybe if it is somewhere within and I didn't see. But I don't see the linkage that you have created and the value you have placed on it to say that it is having economic impact. If you can clarify. Thank you.
Please go ahead.
Okay. Mine is a comment. And to the team of researchers, I would say that you have really done a great job looking at the flow of the abstract and assessing the methodological rigor. You realize that they really did a great job, and all the structures and even the conclusion, you realize that the flow is there. So I really want to commend them, and then we need to learn from them. Thank you.
Thank you so much. Okay, Madam, the last one.
Good evening, House. Please, my name is Gertrude Hillary, and a delegate from Brong-Ahafo region. I do have a question concerning the strike action. I work in a CHAC facility, and one of the things I know, or since I started training, working a decade ago, is mostly during the strike, it's always difficult for the CHAC facilities to go on strike, even though it's for the benefits of the union or for all nurses. But the management of most CHAC facilities, I work under the gas. It's always difficult for us to go on strike. This recent strike we went this year, we had to go to work, even though we didn't like it, but we're being forced to go to work because we didn't want it to be tagged if we don't go. I would like to know, what can you do to help some of us so that we can stand firm when it comes to these things because of intimidation? Thank you.
Okansi, where did you come from? I said she was the last one.
No, madam.
Eh?
Kindly permit me. Thank you, Madam President. Please kindly permit me. Yes, initially you said 5 people for 5 questions. I
We
never
got 3,
knew.
so it's enough so that the program can go
Yes, thank you. I never knew recommendations were allowed.
Okay.
So I'm on my feet to recommend the team.
To commend?
Yes, for their good job done.
Okay.
Thank you very much.
Thank you. Thank you very much, our researchers, for your presentation. But I have a question on the data collection. You mentioned before, during, and after. And I want some clarification on that. It was like you were waiting for a strike to start, and then you went to do the data collection before the strike. That was how I understood it. Or it is a retrospective. After the strike, you collected the data, they gave you the data as in before the strike, how many hospital attendants they had. Is that what you mean? I need some clarification.
Okay, so
because it wasn't clear.
responses will be given. So Pediatric Nurses Society, be getting ready. I had said emergency nurses will start, but let the pediatric nurses do it. They are the children, they are the babies, infants. Let them do it, and then you follow them. I hope their slides are ready. Francis. Okay, GS
right.
is answering.
Thank you, Madam President, and good evening to you all. Yeah, so to start from residency to pharmacy, it was a retrospective study. So the action had taken place already. Then you went in there to look at those variables. We wanted to know what were the OPD attendance like, maybe 3 days before the strike. The strike was 3 days. So in the course of the strike, what was OPD attendance? 3 days after the strike was called off, what was OPD attendance? So this is purely a retrospective study. And that is how we came up with those findings. Sister wants to know what the CHAC facilities can do, so in case of we declare a strike action. Of course, you are members of GRNMA and you are paid by government. And whatever action that is sanctioned by GRNMA, you ought to participate. However, over the years, we've realized some of the intimidatory tactics that your leaders tend to put in your way. as we even speak, we have issues on our hands. We have to even pay monthly stipends to the tune of 4,000 Ghana cedis to some of our nurses that embarked on a strike in 2020 and found themselves, penalized, howbeit illegally. So we know the challenges that we face, but I think we can put our heads together as a family and get to empower it. All right? We know that in your appointment letters, and recently in the appointment letters of Ghana Health Service, they've slotted in some statements that you have no right to go on strike and all that. Those things is just a facade. What I would like to humbly suggest to you is that they cannot intimidate anybody. When we have to go on strike, we will do what is necessary to get you to join us, all right? Because they don't pay you salaries, okay? You are not, what's the name? A contract staff. All nurses and midwives practicing in charge facilities are paid by government. And if they cannot motivate you with the internally generated funds that you are generating, why would they stop you from advancing your economic interests? They don't want you to prevail economically. So we will put our heads together. As time wears on, we will find other innovative ways to let them know, if you have to go through due process of law, to get them to understand that they cannot stop you from embarking on a course of action that has been duly sanctioned by a union that you so belong. As I said, it must start from capacity building, and we just have to empower you for you to stand on your feet. Yeah, don't fear anybody. I mean, we can't fear God and fear man. Okay? I have said, and Madam always say it. You see, strike is not something that should even be mentioned among essential staff. But if you have studied the history over the years, as was, alluded to by Francis, you realize that sometimes when push gets to shove, we need to really push. All right? We need to take certain actions. Because it's like, when doctors need something, they will give it to them. When nurses need something, and our leaders don't put it across. We put it across. When you go to the negotiation table, if you get to the negotiation table and you see how Madam President push for things, you'll be amazed. I have been there since 2006, and I tell you that our leaders have been consistent in fighting for our members. But when sometimes it's like people don't take us for seriously. That is why we need to also show other aspects of our
So your question of whether we evaluated the economic impact, of course, let's even take it from this angle. In your facility, your admissions used to be 740 a day or a week. Now, in the whole week, you had 3 economically. But there are other studies that have also evaluated the economic impact. And one study cannot address all questions. Is that okay? So thank you so much.
I just let you know that this has been published. This work has been published in +1. So when you go into +1, you can see there. It's published, and it's a Scopus journal and internationally or widely read. Thank you, Madam President, for the opportunity given us.
Thank you so much. So at this time, I'll invite the Pediatric Nurses Society to come up and do their presentation. Emergency nurses, be ready. You'll be followed by Gaspon, and we'll continue from there.
Thank you very much, Madam President. I'm grateful for the opportunity. So I'm standing on behalf of the Pediatric Nurses Society under the umbrella of GRNMA. So this is our presentation outline. So, this group was formed in 2016, but it came into realization on the 5th of October 2018 at Shiashi, which is our headquarters. And it started with 500 nurses, basically pediatric. And we have our secretariats running at the 10 branches in the regional demarcations of Ghana. So the Pediatric Nurses Society of Ghana remains steadfast in its mission to promote excellence in pediatric nursing practices, education, research across Ghana. This report aims to capture our efforts and accomplishments across the various core areas being highlighted. During this quarter, our activities were concentrated on the following areas. So,
can we have some silence, please?
Leadership. And our leadership is such that it has cut across all the regions of Ghana. Our chair being at the Greater Accra, myself at Central Region, our first vice at Bono, second vice at Upper East, and then Assistant Secretary at the Northern Region, the National Organizer at Tamale here, Treasurer at Insawam Government Hospital in Eastern Region, to talk. So we are cut across the whole regions. So, the Pediatric Nurses Society is a professional society under the umbrella of GNRS, I've already said. So, our objective is promotion of friendship and understanding among pediatric nurses, neonatal, and all professionals dedicated to the development and promotion of child health. So if I talk about pediatric, it's not just about pediatric nurses alone. We are now having a lot of neonatal nurses. Me, myself, I'm in the training, and we are all under the umbrella of the Pediatric Nurses Society. And then to also encourage research into all aspects of pediatrics to advocate for universal rights of children in Ghana and beyond. So these are our training institutions. This is where we get our membership from. University of Ghana, UDS, and then Ghana College of Nurses and Midwives. So our membership is made up of pediatric nurses, pediatric nurse specialists, neonatal specialists, pediatric oncology nurses. So I will escape this for the time's sake. So these are itinerary programs that we have every year. Executive meeting, general meetings with the regional executive, participation at the council meetings, visitation to the various regions to strengthen our membership across the regions, yearly celebrations, media talks, Zoom presentations, holding of conference, and then national meetings. So these are, for this year particular, these are some of the activities that we have carried out successfully. This year, like this, we were able to hold our conference, and it happened here in Tamale. So it's like everything is coming to the north. So if you study our itinerary wall, some of the program we couldn't achieve. I think after the conference, everybody was kind of exhausted. But that does not mean that we're not doing other activities. On our platforms, there are a lot of things happening, the case presentation, and recently, the Ghana Health Service also has partnered with us to have one common platform for e-learning, which is happening on our various pages. So all the pediatric nurses there, I believe, if you have not registered, then try and take the opportunity and register yourself. Our achievements. Successfully had our biennial conference at Samali, the meeting with our parents and executive meetings every first Sunday of the new month, visitation to some parts of the regions, and then representing the society on the HPV vaccine workshop that happened at Lancaster Hotel at Accra, and also reading the solidarity message on behalf of our president. And we say thank you for the opportunity that you have given us. So meeting with the PSG on proposal to have a joint meeting or programs with them. if you realize almost all the activities that they run is being done by we, the neonatal nurses or the pediatric nurses with them. So we deem it, why don't we have one common ground when it comes to these celebrations? So at least wherever they project the logos, our logo can also appear, because we need to have that visibility. But unfortunately, it's like they see us as a threat. I don't know, one way or the other. With our meeting with them, it didn't go well. So we leave it for. And then we are also now collaborating with ACA, African Respiratory. They also reach out to us, which we had one webinar already with them, and we are on it, and we promise to have a good time with them in the future. So case presentation on the WhatsApp page with the use of the ISBA. Most of our members are in the hinterlands, and it's hard to reach areas. Some to the extent that they don't even have ambu bag to even resuscitate a neonate or children. And it's really, really alarming. So we deem it that if you have a case, follow the ISBA, present it on the page, and members who are on the page will help to give advice as to what to do at wherever that you find yourself. And then, as I've already said, the e-learning collaboration that we are having under the directive of the Director of Nursing, which is happening. The members winning awards on the various platforms, then participation in the council meeting. And then challenges, the redundancy on part of some of the executives. And then neonatal nurses also planning to have separate groups. So we are pleading that we all be under one umbrella to push one common goal. And then those with the LGN background, please, this place, I need it seriously, please, hear me out. There's one challenge we are having. You know, the Sick Kids program started at Legon. And most of our members who passed through that program wanted to go to GCNM to do the top-up, but they are not getting that opportunity. So I think that is also another challenge in the pipeline. And we have contacted the rector, but currently she's not around, so we are praying that we'll meet her to see how best our members can get the opportunity to upgrade themselves. Not only that, those who also did the pediatric at the UDS, the Legon, they are also seeking that the college should give them the opportunity to do the top-up for 2 years. So these are projections for 2026. That's training about 5 pediatric critical care nurses is dear to our hearts. Currently, as we talk, we don't have one. Since the country has none at the moment, and to be able to establish the said training locally to aid reduce infant mortality. Then meeting with the rector at the GCNM, as we said, with our parents, who is Dr. David Chum Tinkrine, and then network and collaborate, and also continue with the webinar and then the case presentation. Provision made for, we also plead with our mother to at least make provision for specialized societies in the Constitution to include voting rights. And also periodic leadership training for our members. And then also award categories for specialized societies. And then regional council meeting with the specialized groups. Also re-registration of our membership. Now currently a lot of them has JAPA. For Western like this, all the executives we had there, all of them has traveled. So now we have to really look at another people to occupy the seat. That is what is happening there. It's serious. Even one was on her way out, but she came and really stood to be elected as a secretary, only to realize that the following week she's just gone. Then regional training for capacity building in clinical practices, then design a website for society as part of international visibility, then our calendar of our events.